Every day, 130 Americans lose their life because of an overdose on opioids. This statistic is from the NCHS, or National Center for Health Statistics, and it is an alarming number. Hi, I'm Timothy Hodgkinson, and I'll be talking to you today about the opioid crisis and how the overuse of the drug Narcan could be unintentionally worsening the opioid crisis. So, what is Narcan? Narcan is a drug that can be administered to a person who has overdosed, and it will quickly counter-effect whatever they have overdosed on, and this will ultimately save their life. So, how is a drug that is saving lives worsening the opioid crisis? The answer to that is quite simple, really. It's because Narcan does nothing to solve the root of the problem, which is drug addiction. And that is why I believe anybody who has been saved with Narcan should not be allowed to receive Narcan again. As of today, Narcan can be purchased in many states over the counter without even the need for a prescription. And the drug Narcan is also patent protected, making them virtually competition free. And in an opioid crisis, there is going to be a high demand, causing the price of Narcan to skyrocket. And along with these increasing cost of the drug, additional cost has also been spent on widening the efforts on education and how to use Narcan. And even with all of this cost and effort, deaths from caused from drug overdoses have fallen only by a small percentage. In fact, an editorial published in the Tribune, a news service that provides breaking news in service and stories in Chicago, examined how nationwide the prescribed amount of Narcan doubled while overdoses fell only by 3%. And in this graph I have here, I can show you that WLRN News made this, and it shows the price increase of each vial of Narcan purchased by the Fort Lauderdale Fire Rescue. And you can see in 2012, it cost them only $22 for a multiple use vial, whereas in 2016, for the same exact thing, was costing them $102. A huge, huge increase in price. And then from the National Institute on Drug Abuse, I have a graph that shows you the number of deaths involving opioids, and you can see just from 2002 to 2017 the exponential growth that has happened involving opioids and drug-related deaths. Increasing the availability of Narcan isn't just a cost concern either. Another issue that arises with the easy access of Narcan is the possibility of it becoming a moral hazard. And Rick Morgan, an author from CNBC News, describes a moral hazard as a safeguard against a risky behavior that will ultimately increase participation in that risky behavior. There's evidence out here that supports this claim as well. Jennifer Dolak of the University of Virginia and her co-author Anita Mukherjee of the University of Wisconsin discussed that data shows that Narcan is hurting the opioid crisis more than it is actually helping. Both Jennifer and Anita viewed data, and it shows that laws making Narcan more accessible caused opioid-related deaths to increase by 14% alone in the Midwest. This is giving people access to a life-saving drug. Sounds good in theory, but it is actually having the opposite effect. This study was questioned by other professionals, asking if there was any correlation between the data, and the study did find that access to Narcan works best in large cities where there were treatment programs present. And so the main point of this is just showing you that Narcan itself is not nearly enough of a solution to the opioid epidemic. Here I have a graph from the U.S. Centers for Disease Control and Prevention, and here I'm just highlighting, you can see that the Midwest by far has the highest numbers of opioid mortality from 1996 to 2016. Just highlighting that just because we have unlimited access to Narcan, deaths from overdoses are not going down. And in fact, if we are increasing the cost and investing so much in having so much Narcan around, why are we not investing in keeping people off it from needing it so many times in the first place? And there are other solutions out there that aim to do just this in the first place. So alternatives to the overuse of Narcan medicines such as buprenorphine, and Steve Ham, the author of New Strategies for Combating the Opioid Epidemic, looks at how schools like Yale are using medicines like this, buprenorphine, in fight aiding and fighting against the opioid addiction. And this medicine helps to reduce the intense cravings that you get with withdrawals from opioid addiction. A study that highlights how medicines like these that prevent these intense cravings can have a huge impact on the opioid epidemic. And a study done by JAMA, which is the Journal of the American Medical Association, looked at 57 patients undergoing detoxification of opioids and found that only 6 out of those 57 patients remained in treatment. They then gave a group of 56 patients buprenorphine while detoxing. And of the 56 of those patients, 37 of them remained in treatment. So Ham, the author, notes that almost 90% of people trying to detox or remain abstinent will relapse within just 6 months of after undergoing detoxification. So medicines like buprenorphine could help people stay off of opioids and reduce the number of opioid overdoses. So if we are saving the lives of those who overdose in the first place with Narcan, then we should make sure that they have a fighting chance of staying off the opioids that made them overdose in the first place. And medicines like buprenorphine could help with this. Illustrating just that, I found this graph, and it looks at treatment days. And in the purple line, you can obviously see those who were maintenance, just meaning they were on medicines, and how much longer they last in treatment than those who are just going detoxification without any sorts of medication like buprenorphine, and just the steady drop off of how many days they get. It's almost ridiculous that we are giving people Narcan without giving them medicines like buprenorphine to help keep them off this in the first place. The opioid epidemic has affected many lives, from the addicts to their families and loved ones. And Narcan has played a big role in saving the lives of those that overdose, but Narcan clearly is not enough. The overuse of Narcan isn't helping, and we need to implement the use of medicines such as buprenorphine to help addicts overcome their addiction. So limiting the use of Narcan might seem like a punishment, but it could lead to the life-saving prevention that addicts need.